Normal delivery with PV excitation. Normal delivery, also called vaginal delivery, is the natural process of giving birth through the birth canal without surgical intervention. Stages of normal delivery. 1. First stage labor. Regular uterine contractions cause cervical dilation and effacement.
Onset begins with true labor pains and ends with full cervical dilatation and centimeters. Mechanism: regular uterine contraction, cervical effacement and dilatation. Duration: premi-gravite a 12-14 hours, multi-gravite a 6-8 hours. PV nodes: PV or vagination is done every 4 hours to assess cervical dilatation and effacement. Station of presenting part: membranes at us intact, ruptured, pelvis adequacy. Indications for PV exam or admission: before, after giving oxytocin, before analgesia, anesthesia, on suspicion of complications, contract insertion, and postpartum hemorrhage, placenta previa, leaking without active labor to prevent infection.
2. Second stage delivery of baby. The cervix is fully dilated 10 centimeters.
Onset from full dilatation of cervix to delivery of baby. Duration: premi-gravite up to 2 hours, multi-gravite a 30-60 minutes. Mechanism: expulsive uterine contractions plus maternal bearing down efforts. Cardinal movements: engagement, descent, flexion, internal rotation, extension, external rotation, expulsion. PV nodes: PV is usually not repeated frequently in this stage. Asterisk cascus, done only if there is delay of fetal distress to confirm descent and position.
Third stage delivery of placenta. The placenta and membranes are expelled from the uterus.
Onset from delivery of baby to expulsion of placenta and membranes. Duration: 5-15 minutes, should be 30 minutes. Mechanism: placenta separation, shove/dumbcunt mechanism, expulsion. Management: active management with oxytocin to prevent postpartum hemorrhage. PV nodes: PV exam not routinely required unless placenta or expelled or suspicion of retained tissue. The fourth stage of labor is the period immediately after the expulsion of the placenta and membranes. First 1-2 hours after presented EUV. Observation: mother monitored for bleeding, uterine contraction vitals, and bladder emptying. PV nodes: PD only if excessive bleeding or suspicion of genital tract trauma.